Hello, my name is Jalen Bird, and I will be doing my capstone presentation on cannabis use for pediatric epilepsy. So for my capstone presentation, I will be talking about in the pediatric epilepsy population, by what method do physicians manage pediatric patients with epilepsy using cannabis versus pediatric patients with epilepsy not using cannabis, decreased seizure activity. So, what is epilepsy? Epilepsy is a brain disorder that causes abnormal brain electricity and can result in 2 or more seizures. These seizures can be affected on both sides of the brain or only one area of the brain. They are either generalized seizures or focal seizures. However, there are some seizure or some form of epilepsy where the seizures are uncontrolled. So you have the Dravet syndrome and the Lennox-Gastaut syndrome. Here is a short clip of a patient or a baby having a seizure. So as you can see, the seizures that babies have are not like the adults. The adults are more dramatic, they're more violent. You can see them falling to the ground and shaking uncontrollably. Treatment options. So the first thing, with pediatric patients who are having seizures, they are going to do an EEG. So the EEG is a test that detects the brain waves in the brain. A normal EEG has uniform and regular brain waves, whereas a normal EEG, they will have bizarre, disorganized brain waves. Another type of treatment option is ketogenic diet. So this is usually a low carb diet and a high fat diet. Also, you have hormone replacement, which is ACTH replacement, and you have medication, which are your anticonvulsant or anti-seizures. Lastly, you have surgery. Surgery is when the surgeon goes in to the brain and removes the lesion that is located in an area that is causing these seizures. So, effects of pediatric epilepsy. Mental retardation is one. Mental retardation is because the lack of oxygen that is going to the brain. When a baby or a child has seizures, the brain lacks oxygen. Severe lifelong epilepsy, risk for autism or death. Secondary cause. Secondary cause is when the parent is forced to either move, or they're unemployed, or they don't have the money to provide the medication or the treatments that this child needs. Suppressed immune system is another one. Because of the medication that the children are getting, they can sometimes suppress the immune system, such as steroids. So the baby is now at risk for infections, and also they have common side effects. One common side effect of the medication is drowsiness or grogginess. So let's begin with the basics of cannabis. So you have 2 common strands, sativa and indica. Sativa is more tall, thin, skinny. They have more of an activating response, whereas indica is more short and stout, thick, and they have more of a calming effect. With both of these strands, THC, and CBD are the 2 main ingredients. So the THC is what we usually feel with recreational marijuana, because this is more of the euphoria, hunger, and paranormal effect. Whereas the CBD is more of the anti-seizure effect, and this is what pediatric epilepsy treatment would be, the CBD enriched medication. In the United States, there are 26 states that has formed some type of law with legalization of marijuana in some type of form. So this could be recreational use or medical use, or it can be the state can only issue out CBD enriched marijuana. Within the United States, 7 states have laws that have legalized marijuana for recreational use. Again, some of the recreational and marijuana, some of the marijuana that is used for recreational or medical use have the same amount of THC, so there's not a big difference. However, under the DEA, Drug Enforcement Administration, marijuana is considered a drug of a Schedule 1 classification. So this makes all form of marijuana distribution is illegal. There is potential use for it to be abused, and there is no use for medical reasons. So this is under the federal law. So with the literature that I have researched, some of the studies show that the THC content is low. However, the response rate or the number of reduced seizures are high, and the CBD content is low. So you have low CBD content, you have low to none THC content, you have a reliable number of participants, and you have a reliable number of response rate or less seizures. So with the studies that I have researched, there is no bias. So randomization is none, the blind outcome assessment is none, placebo controls are none, and EEG verification of response is none. Some of the adverse effects that one study realized was sleepiness, diarrhea, loose stools, tiredness, and decreased appetite. They found these results by looking at parents and looking at the results of using the CBD enriched marijuana, and these are the adverse effects. Moving along, another study that I researched was a study with pediatric patients who have the two common uncontrolled seizures. So 79% of the patients with Lennox syndrome had fewer seizures, and 60% of the participants with Tourette syndrome had fewer seizures, and all other forms were 69% had less seizures. Moving along, there was another study. So this study included more than 70 participants who relocated to Colorado. So 34 people or participants moved their family to Colorado for a better treatment, and 47% actually reported a better response rate, meaning they had fewer seizures or no seizures at all. Whereas the people who were already in California, there were 41 participants, and 22% reported a response rate. And this study also included the two main epilepsies that are uncontrolled. So two popular pharmaceutical companies are the GW. This pharmaceutical company offers an oral solution or oil, and this is pure CBD. This has low or none to THC content or ingredient. Also, you have Incest. Incest offers synthetic chemical to be to look like the CBD, cannabis use. Moving along, you have barriers. So some of the barriers that I have came across is a lack of research, and a lot of physicians or pediatricians do not do research in this because of the DEA position, because like I said before, marijuana is a Schedule 1 drug classification. So no medical use, and it has a potential use to be abused, and no distribute. Moving along, you have the consistency of products. So there are some testing companies that you can send your product to, and they can give a breakdown of how much THC, how much CBD, or if your product is contaminated. However, most of the time, your product or what the testing companies are finding is it's not consistent, and they cannot find a half-life. And lastly, drug interactions. So with the marijuana, there are interactions with some drugs that we use, such as warfarin or aspirin or your metoprolol, your blood pressure medication. Some of these can increase the blood levels and can cause some side effects. Lastly, we have the CARES Act. So the CARES Act is the Compassionate Access, Research Expansion, and Respect States Act. This bill was introduced to the U.S. Senate in 2015. This bill is introduced because it's trying to move the marijuana from a Schedule 1 to a Schedule 2 drug classification. Examples of Schedule 2 drugs are morphine, Dilaudid, methadone, or cocaine. Schedule 2 means that even though this drug can be abused, but it can serve some medical benefits. So they're trying to move marijuana from a Schedule 1 to a Schedule 2. And this can protect the physicians and the state by the federal law. However, this is a wait to get approved for this bill, and it is still a pretty high wait for this. Usually it's about a year, at least a year, you can get approved for this CARES Act or compassionate use. These are my references, and this concludes my presentation. Thank you for watching.